Thank you, Chief. Okay. Good afternoon, everybody. Individuals in San Diego County facing mental health issues frequently come in contact with law enforcement and with our criminal justice system. Too often, the outcomes fall short of helping people who face those challenges. Sometimes the consequences are even fatal. The evidence of this critical intersection between individuals with mental health and substance abuse issues and the criminal justice system is really compelling. Last year, police officers across the county responded to 54,000 calls involving mental health. And we also know that 79% of those involved in officer-involved shootings have a combination of mental health and substance abuse, or one or the other. That's 8 out of 10. And sheriff's data also shows that 30% of individuals that are in our jails are on some sort of medication for mental illness. We know many more than that also suffer from mental illness but are not medicated. One of my key public safety priorities as DA is to create and improve the response of the criminal justice system to those who suffer from mental health issues and addiction. Our goal is to use data, multi-system collaborations, and community partnerships in order to treat those who suffer from mental health issues and substance abuse more humanely, with more dignity, while balancing that with the protection of public safety and accountability. We believe that we can achieve that balance. In order to advance this important public safety initiative, we brought together over 200 stakeholders. These are experts in a variety of fields dealing with mental health, homelessness, and the criminal justice system. They worked for over a year, especially at 2 long symposiums, to identify the gaps and the issues and to create solutions that we can move forward. We created, with the help of our stakeholders, concrete recommendations for transformation and reform that we're sharing with the community today. In the spirit of transparency and of having a shared responsibility, we believe releasing this report makes the most sense and will move us forward. There needs to be a sea change in the way we address the needs of people who are living with mental illness in our community and are involved in the criminal justice system. Today, we're announcing 2 large-scale regional initiatives that move us forward in accomplishing these priorities. These 2 initiatives deal with persons who interact with law enforcement and with first responders who also suffer from mental health or substance abuse issues. These initiatives begin that sea change. These initiatives are based in evidence. First, we're announcing $1.5 million in funding for crisis intervention and de-escalation training for police officers and dispatchers. Second, we're distributing a 911 checklist that family members who have a loved one that suffers from mental illness and addiction can use to guide them when they call for help, when they call 911 for help. It guides them as to what information they should provide. These 2 initiatives represent a step towards a new approach for mental health in San Diego County, one that improves the way that law enforcement handles individuals facing mental health challenges while keeping our neighborhoods safe. I'm pleased to announce that my office has identified up to $1.5 million in asset forfeiture monies. And instead of spending them on equipment and other things, we were able to prioritize this funding that will allow us to offer this access to this new and enhanced training in crisis intervention and de-escalation for police officers regionally across the county. The curriculum has new aspects and also builds on proven training that already exists in our county, mainly offered by our great PERT professionals. It will include classroom discussions by PERT experts, role-playing real-life situations, and use of the state-of-the-art video simulator in order to enhance the training and the learning. This is called the Milo system. It's an interactive simulator that improves on similar training systems currently available in San Diego County. We know that sometimes the best training involves a full engagement of the learner. Officers will also be trained to recognize the signs of methamphetamine toxicity. This is a big issue in our county. We know that almost half of people booked into our jail have meth in their system. We also know that most individuals involved in an officer-involved shooting or an in-custody death have meth toxicity or a form of meth in their system. We anticipate this training to start as early as this summer. The district attorney's office, my office, is uniquely positioned to collaborate on this training. Since we work directly with every law enforcement agency across the county, we are the people's prosecutor. We're responsible for reviewing officer-involved shootings. And we pride ourselves on these partnerships and working in collaboration to advance the level of excellence that already exists in our law enforcement partners. We're committed to providing this access to these tools in support of law enforcement officers, dispatchers, first responders, and others who may come in contact with people in crisis. The goal is one that I think our community can truly embrace: a reduced need to use deadly force, improved officer safety, and a reduced likelihood of injury to those in crisis and the public. Working with NAMI San Diego, we have also developed a 911 mental health checklist. Tens of thousands of these cards are printed and will be distributed in English and in Spanish. They will go to a variety of our psychiatric hospitals, to our jails, to all our police agencies, to everywhere where families may be getting counseling for mental health, so that they can be widely accessible to persons in crisis. The card contains a checklist of very important information that callers should provide police dispatchers when a family member is in crisis. The 911 card will help the families answer these critical questions, and it will allow officers to be more prepared as they arrive on scene. These questions are common sense, but many times when people are in crisis, they don't think ahead to have these answers ready. But if they have the card, they pre-prepare the answers, they are able to respond. At the same time, we're training dispatchers to ask those questions so that between the family members and the dispatchers, we can get the job done. These questions include things like, does the person in crisis have access to weapons? Do they have a mental health diagnosis? Are they on any medications? Do they have a drug of choice that they use? Have they taken any drugs? Have there been prior police contacts where the situation was handled calmly and was resolved successfully? What techniques did that officer use? What works with your loved one to calm them down? Is there any prior evidence of violence or current violence? The idea is to provide responding officers with more information about the individual's mental state and history before they arrive on scene. Hopefully, this will improve the outcome of the interaction. We pride ourselves in San Diego County for strong collaborations and persistent efforts towards excellence in public safety. That's one reason we remain one of the safest urban counties and cities anywhere in America. The Police Chiefs and Sheriffs Association, that's consistent of all our police chiefs and sheriff, has supported this priority. Many of the agencies have been working alongside of us and alongside PERT to work on this regional crisis intervention and de-escalation training. Many have already committed and signed up for this training so that when the classes open, it will be full. With me today is Escondido Police Chief Craig Carter, who is the president of the Police Officers and Sheriffs Association. Chief Carter?
Thank you, sir. I'd like to first start off by thanking the District Attorney Stephan on putting this program forward. When she introduced us to the association, it was an overwhelming response of we're all in to help. Also, I want to appreciate the fact that that came with the funding, and that's always the problem for us. As you all probably know, we do the de-escalation training. We have mental crisis training in the academy. But this takes that a step further. It allows us to have that training as we're out in the field and now maybe have dealt with some of the individuals in crisis, and this is going to help us with more tools to cope with those in crisis while we're in the field and getting our dispatchers trained at the same time. This is something we haven't seen before. And I can tell you that on behalf of all the chiefs and the sheriff, everybody in this county had a representation at the table and had input. So what you're seeing today is a collaborative effort. And when this is rolled out, we hope to get all of the law enforcement officials in this county through that training within the 3-year time of this program in order to be able to handle those 54,000 calls a little more efficient, a little more safely, and much more educated on how we have different tools in our toolbox that can help us solve these issues peacefully and with the least amount of force necessary. So I couldn't be more proud to be part of this. Our chiefs and the sheriff are all the same way with this. We're excited to get this rolled out and get everybody in our departments trained up and have it be a safer environment for those in crisis. So thank you for that.
Thank you, Chief Carter, for your leadership. It makes all the difference. Thank you. Also with me today is Dr. Mark Marvin, who is the director of PERT, the County Psychiatric Emergency Response Team. As you may know, PERT teams work alongside law enforcement responding to individuals in crisis, and they do an amazing job. However, one thing that people may not know is that even though they may be on scene, they're not able to intervene if the situation is volatile at the time. So police officers have to intervene. This is why they are working hand in hand to enhance the knowledge of police officers on how to respond to mental health crisis. They've been working on this for a long time, and this takes it yet another huge step forward. Dr. Marvin and his team have been key advisors, helping us to create the curriculum for the crisis de-escalation training, and we so appreciate their expertise in this area. Dr. Marvin.
Thank you very much. I appreciate being here, the invitation. Let me give you some context because I believe this will really highlight the power of collaboration that exists in this county. PERT has actually been providing services, clinical services and training for 23 years. So we have somewhat of a feeling of pride when we hear of a major city, typically on the East Coast, that is just discovering that actually mental health services can join with law enforcement to assist people who are living with severe and persistent mental illness. Over the last 4 years, PERT has grown in teams from 23. We are now funded for 72. Last fiscal year, we responded to roughly 10,000 crisis calls out in the community. But that's just basically around a quarter of all these calls coming in, people in crisis, these calls coming into dispatch services. So we want to enhance that. Likewise with the training, PERT has been delivering training for a number of years. This county is way ahead of other counties. The state requirement for law enforcement officers is 12 hours. This county requires 15 hours of classroom plus 12 hours of scenario-based training. For field training officers, the state requires 8 hours. The County of San Diego, all the law enforcement agencies agreed to provide 10. Despite the number of trainings that we provide, we are thrilled to be partnered with the DA's task force in this project because we cannot be complacent. We are always looking to evolve. So our collaboration with the DA's office will remarkably expand not only the training offerings, but also the menu, the type of trainings. For instance, it would be great to be able to provide specialized little blocks of training, maybe focusing on kids issues, perhaps focusing on cross-cultural issues in our various community sectors here in the county. Developmental disabilities, dealing with folks who are connected with the regional center. So we want to continue providing the top state-of-the-art training for law enforcement, including dispatchers in the identification, signs of mental illness, and how to respond effectively, safely, and compassionately, and make sure that we get people connected to services. So thank you very much.
Thank you, Dr. Marvin. Thank you. We are so fortunate here in San Diego to have Dr. Marvin, who was one of the key leaders in the symposium that put forward the blueprint with recommendations. Thank you. NAMI San Diego stands for the National Alliance on Mental Illness, and in many ways it is San Diego's voice on mental illness. They speak for the families and the individuals who suffer from these illnesses and have worked for years to break down the stigma that's associated with mental illness. NAMI San Diego CEO Catherine Nacario is here today. They've been instrumental in compiling the recommendations in the blueprint and advice specifically on the 911 cards that are being distributed. As you can see, we don't do any of this alone. It is thanks to all our partners that we can get this done. In fact, the information about NAMI's incredible mobile app, everybody should have that on their phone. The incredible mobile app is included on the card as an additional resource. Catherine?
Thank you very much. NAMI San Diego is so very much appreciative to you, Stephan and Rachel, for involving us and being the authentic voice of peers, those living with a mental health condition, and the family and caregivers. This card is going to be integral to increasing the safety for our calls that have to come out. Typically in a crisis situation, one of the first things that a loved one wants to do is download a whole bunch of information really quickly to the dispatcher on the phone. So this card will help the individual to be able to walk through a methodical process, give pertinent information that can assist dispatchers in assessing the situation and providing the right types of service during that crisis. And also our OSCAR app, it's OSCER San Diego, Organized Support Companion in an Emergency, is a navigation tool to what to do before, during, and after a mental health crisis. Has a section in there which just gives general facts such as what is PERT, what's a 5150. Then also a whole section on resources. Say you live in the East County and you're looking for a mental health urgent walk-in center, you can go hit East County Urgent Walk-in Center and it will GPS map you to the location and provide the call number for you. Currently, our app is available on Apple and Android and it's 100% free. It's in Spanish and English and will also be converted to all 6 threshold languages within the next 2 years. Not only that, we are adding substance abuse disorder services to the app as well, because often they go hand in hand. And also the 911 card is going to be uploaded under resources in the app as well. So we really appreciate being involved in this entire process. You know, mental illness and mental health conditions are not a crime, but sometimes the behaviors associated with instability or psychotic episodes can lead to low-level offenses, and jail is often not the right place. So we very much appreciate being part of the prevention, early intervention, any type of diversion and education that we can provide. Thank you.
Thank you very much. The county's Behavioral Health Services Division is committed to providing mental health and substance abuse services for residents across San Diego County. As we move forward with these reforms and additional initiatives, they are strong and trusted partners. Dr. Luke Bergman is the Director of Behavioral Health Services, and I'm proud that he's joined us here today. Dr. Bergman.
Thank you so much, Summer. In addition to District Attorney Stephan, I want to thank all of the partners here, NAMI, PERT, and others for their commitments to helping people with behavioral health issues. That includes, of course, the Board of Supervisors, who collectively and individually have demonstrated ongoing and fresh commitments to long-term solutions. We can only solve behavioral health challenges when we work together, as Summer Stephan has emphasized, law enforcement, social support, and healthcare together. We know that at least 70% of people in jail have at least one mental illness, if we're including substance use disorders among those. Meeting the needs of those at the intersection of behavioral health and criminal justice is one of the county's primary goals as we work to reshape the continuum of care. Our goal is to transform from a crisis system to a care system, a system that is better able to keep people stable and enable even those with the most serious mental illnesses opportunities to live well. New opportunities will arise with law enforcement officers equipped to identify and de-escalate people who are experiencing psychiatric crises. We'll be able to divert people from the often traumatizing experiences of arrest and jail into healing experiences with healthcare and social supports. Because of the frequency of law enforcement contact with people with mental illness, and the district attorney and others have offered some of those data today, the commitments that this new initiative are providing to training police in de-escalation techniques is an excellent foundation. It will allow other important pieces to flourish, such as crisis stabilization, follow-up, and care coordination services. Again, I'm thrilled to be here today and truly grateful to the district attorney for her forward-thinking and collaborative spirit.
Thank you, Dr. Bergman. We really look forward to working with Behavioral Health Services, Dr. Bergman, the Board of Supervisors, and HHSA Director Nick Mascione to move all of this forward. Also here today is the Chief of the District Attorney's Bureau of Investigation, Jorge Duran, who leads the elite group of peace officers. I call them small but mighty, that they compose the DA's Bureau of Investigations. I appointed Chief Jorge Duran to this position because of his proven track record of 3 decades in policing, where he has built community partnerships and has built effective innovations in policing. He is nationally recognized for his abilities to bring forward and to enhance police work. Chief Duran has been coordinating with our partners on the enhanced de-escalation training and working with law enforcement across the county. Chief Duran has a statement prepared in Spanish. You're very fortunate. I'm not going to try my Spanish on you. Chief Duran.
Thank you.
El año pasado, oficiales de la policía en el condado de San Diego respondieron a más de 54,000 llamadas de servicio que involucraban el problema de salud mental. En un estudio de balaceras involucrando a oficiales en nuestro condado muestra que el 79% de los incidentes incluyeron sujetos con problemas de drogas y o salud mental. Hoy estamos anunciando varias iniciativas diseñadas para mejorar la forma en que las autoridades policiales interactúan con personas con problemas de salud mental, incluyendo entrenamiento para intervenir y desescalar en crisis para oficiales de la policía, una lista de verificación de evaluación mental antes de llamar al 911 y un plan completo para la reforma de salud mental que contiene recomendaciones especiales para reformar el sistema y mejorar los resultados de la seguridad pública. Me complace anunciar que nuestra oficina ha identificado hasta 1.5 millones de dólares en fondos para ofrecer acceso al entrenamiento para intervenir y desescalar en crisis para oficiales de la policía en el condado de San Diego. La capacitación consiste en un plan de estudios recientemente creado que se basea en y mejora la capacidad actual que reciben los oficiales del orden público. Al trabajar con NAMI en San Diego también hemos desarrollado una tarjeta con una lista de verificación de evaluación mental del 911. Decenas de miles de estas tarjetas se están imprimiendo y distribuyendo en inglés y español al público. El objetivo de proporcionar a los oficiales que responden información adicional sobre el estado mental y la historia del individuo antes de que lleguen a la escena, con la esperanza de mejorar el resultado de esa interacción. Hoy también estamos lanzando un plan detallado para la reforma de salud mental, que incluye 30 recomendaciones específicas para mejorar los resultados de la seguridad pública. Trabajando juntos podemos y haremos mejorar cuando se trata de atender las necesidades de aquellos en nuestra comunidad que enfrentan desafíos de salud mental cuando entran en contacto con el sistema de judicial penal. And I just wanted to say that I'm very honored and privileged to be working with other law enforcement agencies in the county to show the motivation and the enthusiasm which way they've adopted this new process for training. It is a need, it's a necessity to equip our officers with the tools needed to resolve many of these mental illness calls so they are able to resolve the situation peacefully and are able to return home to their family safely. Thank you.
Thank you, Chief. And I owe also a big thank you to Deputy District Attorney Rachel Solov, who is here as well. Rachel is Chief of our Criminal Justice and Mental Health Reform Strategies in the DA's office. This is a newly created position that I created when I set this as a priority to help reform our response to those who suffer from mental health and addiction. She has been an instrumental person in coordinating with our law enforcement and other stakeholders, and in leading the mental health symposiums with our stakeholders, and in producing the blueprint for mental health reform that is now being publicly shared. Today, we're excited to publicly, that's Rachel Solov right there. Today, we're excited. We're only as good as the teams we have. You all know that. And I could not be prouder of the team in the county and then my personal team that works in the office on these initiatives. We're excited to publicly release the results of more than a year of dedicated work by all of our justice colleagues, health partners, and community stakeholders in a groundbreaking document. The document is titled A Blueprint for Mental Health Reform, a strategic new approach addressing the intersection of mental health, homelessness, and criminal justice in San Diego County. I always say you wouldn't build a house without a blueprint. So we can't build anything forward without a blueprint to guide us and to hold us accountable that we're actually putting forth the solutions that we all came up with together. It can be found on our website at thesandiegod.com, and I encourage people to study and look at it. The document contains specific recommendations for how law enforcement and the justice system can better respond to people facing mental health challenges, including supporting the creation and expansion of crisis de-escalation training for law enforcement, the 911 cards that we shared with you, the 2 initiatives that we're announcing today, and with the 911 card. Rachel's work over the past year as we gathered this input has been incredible. As you may know, May is Mental Health Awareness Month. So many families, we all know someone that suffers in silence from mental illness or addiction, or has a loved one who suffers from mental health and addiction. They suffer in silence, and this silence and the stigma that surrounds these issues doesn't allow them to seek treatment and to seek help. And sometimes we, the professionals and law enforcement, we are not properly trained to deal with these issues. What better way to acknowledge May as Mental Health Awareness Month but to take action? Because words are cheap. Action is what our community needs. We are committed to reforming the criminal justice system so it better balances public safety with compassion and understanding for those who struggle with mental illness and addiction. Working together, we can and will do better when it comes to addressing the needs of those in our community who face these challenges. When they come in contact with the criminal justice system, we will be better trained and better ready to address them. Thank you. Do you have any questions?
You said this training, this initiative came after looking at the data, and it's based on data. What trends in the data did you see that said, hey, we need to update our training and how we deal with people with being mental crisis?
Well, one thing in the data is the vast increase in calls related to mental health or substance abuse. 54,000 in our county last year. And as you heard, 10,000 of those, which is a very large number, PERT can respond to. But for many, it is police officers that are responding either alone or with PERT. So being able to advance that. In addition, looking at the last 25 years of officer-involved shootings and seeing that essentially 8 out of 10 individuals are either in a mental health crisis or have substance abuse issues that are affecting that particular incident. Those are compelling statistics, in addition to many other statistics like the people in the sheriff's custody, who are, a third of them are on medications. We also looked around the country for best practices. San Diego had best practices in many ways, in the PERT model, in other models, but we saw this enhanced training in certain other regions, and we saw that it was showing effectiveness in data.
I know the chief said that they get this training when they go through the academy. Is this like a refresh, or how is this different from that, or is this just like a refresh?
It isn't a refresh. It has some elements of the same where you're dealing with mental health, but it has a lot more of the live scenarios of using the simulator to actually, officers go through simulators and training for how to shoot, and they do this routinely. But this simulator is really about how do you respond and understand a person who's in crisis, who's behaving in a certain way that may appear volatile, but if you are trained to see that these are symptoms of a delusion, a psychosis, a meth toxicity, you're able to bring other tools to the situation.
You referenced when the classes open, they will be full. When do those classes commence? Is this over a 3-year period? And is this going to be instituted in phases, like one agency will be trained and then another? How is that going to work?
So we have close to 5,000 officers in San Diego County. So this is a very large number. And this is one of the issues as we came together collaboratively. We understood that PERT is able to train about 350 officers in a year. With 5,000 officers, it was very important that we prioritize this funding so that we can systematically train all 5,000 or so police officers over the 3-year period. So we already have about 25% signed up. So this is the excitement for this type of training that we're seeing. We're making this training have the capacity to be mobile so that it can be taken to the police departments. And that way, because a lot of things that departments struggle with working together is allowing enough officers to be in the field and not taken away. So this saves costs in terms of flying officers to get the training, flying dispatchers to other regions. By making it mobile, it allows us to very efficiently and effectively provide it while allowing enough officers to stay in the field. So I expect it to begin in the summer and to be phased based on need, on what departments, what patrol is the one that is responding the most to these types of calls. So we'll have data drive how we implement and who gets it first. I know that my team of 120 peace officers will be trained. They have a day set aside for training in October, and they will all be trained in October.
So this is a one-day training or a half-a-day training?
There's two programs that are being devised. One is a one-day training, and then there's a more advanced 3-day training.
And all 5,000 officers will get both of these?
Currently, all 5,000 will get the short but impactful PAC training that will include simulator, include pre-information, and will include the behavioral health and the substance abuse understanding and knowledge. So it will all be packed into one day, and then certain officers will get the 3-day training.
Who's administering this training?
We are leading the training with each department has provided their key trainer, their key person that works on their training is working with Chief Duran on this collaboration. And PERT is a very, very important partner to this.
So it was a training that was built in collaboration with existing trainers within the police departments and PERT, put this kind of accessory training together?
Yes, but it has additional elements. It has NAMI as a partner, and they're very important partner to bring the lived experience, to bring the community voice to it. And there's other collaborations that are going on to enhance the cultural sensitivity and other parts of this training.
So community groups and such?
You know, we were consulting with different youth, different pastors in our pastor advisory council, and other partners in the community.
I have a question about other tools, because we know leave the force and those tools, but what you talked a little bit about other tools, and maybe, I don't know if this is a question for Mark or not, some of the other tools that police can move to when they do come in contact with someone that they see some of these issues with. Maybe there's a description of something that you can go through, because I know for officers, you have seconds to think about what to do, like for those situations, and you've got to make your decision. So how did you collaborate on that, and what was the guidance of those tools?
Well, actually, it really starts with dispatch in many cases, so we actually are in process of designing a training specifically for dispatchers. So just to briefly run through that, what this will entail will be dispatchers kind of slowing it down when the phone calls come in and identifying those mental health variables, painting the picture. And then the second component of the training is how are the dispatchers communicating this information to the officers or deputies on patrol. So that goes hand in hand. And the model that we have based our training on is actually rather unique, because many law enforcement jurisdictions have distinct silos, officer safety silo and a mental health silo over here. We are not offering, these are not introduction to psychology courses, these are identifying signs and symptoms. We take both silos and combine them into one. So we have mental health experts that work with PERT, and we also have defensive tactical instructors through the various, our local 11 law enforcement jurisdictions. So it's in tandem. And just like I mentioned with the dispatchers, the goal is to slow it down, identify what is occurring, have a conversation, and think resources. Community resources will also be a big part of the picture, because even on PERS crisis calls, when we respond to a 911 dispatch, in a little over half of those cases is the person actually transported to a hospital under the legal probable cause threshold of 5150. That means we're able to slow it down, have a conversation, talk to family members, third parties. It might be a neighbor, a coworker, fellow student, teachers. Slow it down and let's figure out what's best for that individual. Just like the clinicians do, that's the goal with law enforcement.
I just have two more questions about the training. Will the training include for police officers at schools as well?
It will include, yes,
And then-
definitely.
And where is this happening? You said some of it seems mobile, it can come to you, but is there gonna be a place where people go, or they can use the existing academy, or?
Well, there is the existing academy, which will obviously continue to be the hub, but we also have a large training facility that we will use, and the mobile portion. We want to make it as accessible as possible and designed for the needs of each department. What will maximize the number of officers that can use this while being able to still service the public.
This was a very meaty work plan. There were 10 suggestions. Each suggestion had sub-suggestions. Some of them are things that can be implemented now. Some of them are kind of down the road ideas, like having that mental health crisis center, that, you know, the no wrong doors policy, right?
Yes.
That's something that will take lots of planning and effort.
Yes.
So we had these 2 symposiums. It was a great start. Who's going to kind of shepherd this plan into happening? Like, who's in charge of that?
Well, this was the blueprint that the DA's office led in collaboration with everybody else. As you could see today, we feel responsible to move these recommendations forward. Today, we're moving 2 big recommendations that we can control with these partners that you see here and many more chiefs. So those are going to be done. We're moving forward. There's 3 others that were very fortunate, even while it was in draft form. Chairwoman Jacob and the Board of Supervisors have already asked for action and are moving forward on those 3 big items. And we believe each one of the recommendations builds on each other, and that they're all very important. But we're already seeing essentially 5 recommendations propelling forward. And so this is a very positive start. We're going to continue to work with all our stakeholders to keep pushing all 10 forward.
Those are the 10 recommendations from the blueprint?
Yes.
Okay.
Yeah.
I'd like to hear more about the Milo simulation training. Has anybody in this group
I
done
was
it?
gonna-
Yes, I
Can
comment.
you tell
Yes.
us what, if I'm a police officer experiencing this training, what will I experience?
Yes, as I mentioned, the 2 silos. So what you will have, it's almost an enhanced video game kind of a format. So if you can imagine if this were a screen, I'm an officer. In San Diego County, there's contact and cover officer. If I'm the contact officer, I'm doing most of the verbalization. The cover officer is monitoring for safety. I'm engaging that person in crisis. Hey, you seem to be really distressed. What's happening? Through the various channels or trees, how these simulator videos are filmed, through a computer, if I'm the operator of the system, I can alternate. Either the person is escalating, they're de-escalating, it might be cooperative. We can mix it up back and forth. It's a very lengthy, grueling process to film these videos, and this is actually another area one of my bucket lists is to film local scenarios. I filmed some about a year ago with the California Highway Patrol, and to make it unique to San Diego, certain field locations. And so the defensive tactical instructor is evaluating the officers on officer safety. And someone like myself kind of debriefs them on their awareness of the mental health signs. How did they interact? Sometimes it's the exact opposite of what you think you might want to respond. What do you say to someone who's hearing voices, who might be delusional? How to engage a person and still be very alert to safety, comfort, and de-escalation. So there's a very safe, compassionate trauma-informed resolution. And we can alternate these scenarios. There's a variety of different scenarios, different themes that we use for the training. It's very helpful for the feedback of officers. And again, the power of collaboration, the mental health system, behavioral health services, NAMI, PERT, getting together on these trainings, really, the input is what allows this to happen in this county.
Thank you very much. Sounds like this covers it. Appreciate it. Do we have?